Good morning, welcome back. This is Lori from Finding 50 Fit, and today is week 3 and the first week that we're talking about movement. And I think it's telling that as a physical therapist, I put it at the 3rd week with the importance of sleep and nutrition first. And although movement is obviously very, very important in gaining or maintaining your health, I do feel that sleep and nutrition trump that. So keep working on getting to sleep earlier, keep working on cleaning up your diet, and post any questions that you have in the comments about any topic, any week. So today we're going to be talking about restoration of movement. And if you have ever had a period of time where you've been out of shape and you go out and take a long walk or go out for a run or do something that your body's not used to, you're probably going to feel stiff, and the next day or the next couple days you might feel really, really sore. And so the tightness that has developed over the period of time of inactivity catches up, and when you put that exertion on your body, sometimes it doesn't handle it too well. So you want to build up slowly with regard to movement. And so one of the things that I do with my patients who are severely debilitated or chronically ill is a modality called Cranio-Sacral Release. And what that does is help calm the nervous system down, and it removes some restrictions that are directly affecting the central nervous system, and that helps to eliminate some of the tension that your body experiences when you're exercising, if that system is tight. And really, as a living being that's breathing and moving and basically just the fact of being alive, there's a lot of movement going through your body all the time. In a normal, healthy state, there's still a lot of movement happening in an unhealthy state. So you have your heart pumping blood through your entire body, really, really important. You have your lymphatic system pumping the lymph through. There's really no pump for the lymph system. It's our muscles and movement that moves that. And so that's one of the key important reasons for movement, is helping that lymph system to flow. Your brain and spinal cord are in their own little encasing, and these layers, called the meninges, have fluid underneath the layer called the dura. And so the craniosacral fluid is that fluid that runs around the brain and spinal cord inside of that casing, a very strong casing, and it's really, really important movement to maintain the health and fluidity and function of the nervous system. It's produced in the brain, in the ventricles, and it flows out of the brain and throughout the whole system and gets drained again, and your body's constantly making new craniosacral fluid. And so when you have had any type of injury, insult, trauma of any nature, that movement of that system can be impaired. And if you can imagine, this is your central nervous system that controls everything. If the movement of that fluid and soft tissue or connective tissue in that area comes restricted, then obviously it's going to have an impact on your nervous system. And you're not going to just stop functioning, but you're just going to maybe experience over a period of time not optimal, ideal function. And in the worst case scenario, somebody who really, really is debilitated and in pain a lot of the time and incapable of managing even just simple movement. Maybe they go for a walk, maybe a half mile or a mile, and they're in pain. Those are extreme cases, but that can happen. And this is how the work of craniosacral release can help, because you're getting down to that level of the central nervous system function and relieving restrictions that have a big impact. The work is very, very gentle, and it's very easy to receive. And so that helps for someone who's also dealing with a lot of pain or suffering. And so I'm going to teach you today something that I learned in the initial class. It's something that I do with a lot of patients, and it's a two-handed procedure. And just recently I tried it on myself to see if it could be something that could benefit me as a self-help tool. And I actually had quite a dramatic result just from the first time. And so I'm going to go through and demonstrate it for you. And but I'll tell you the little story that happened. I had an infection in my leg from a bug bite about 2 years ago, and I treated it topically, and the bothersome nature of the rash persisted for months and months and months, over half of a year. And it developed a little cellulitis, and it was just very annoying. It was down on the bottom of my leg, up above my ankle. Last month, the same symptoms emerged on my right leg in the same location for no reason at all. I didn't get a bug bite. There was no new insult. There's no new reason for that to develop. I have believed that infection was remaining dormant in my leg because there's a little mark, a little red spot on the inside of my leg above my ankle that has never gone away. And I have no idea why this emerged, but my body was obviously trying to tell me something. Then the symptoms emerged again on the left leg. So both legs, with no reason, just started to develop these symptoms of this infection again. And I was treating topically again with the antibacterial stuff that I have, some essential oils, and morning and night religiously, and it was helping but not making it go away. So I tried this release to myself, and the next day the symptoms started to improve. And so it's just a matter of releasing these healing capabilities that our body already has, it's already trying to do. And I wasn't doing it for that reason. I was doing it to see if this tool could be useful as something to share here in this forum. But in the process of doing that, it actually helped me clear up this thing that's been bothering me for a month. And so I'm really happy to say that I would definitely try it. And so I hope you enjoy, and I will also be including a handout that if you click on the link in the description, it'll be a handout for diaphragmatic breathing and instructions for this release technique. Diaphragmatic breathing is super duper important. The oxygen we get from the air is fueling our cells, and it's like putting gas in the car. You need the proper fuel. You need good fuel, so you're not going to put diesel in a regular car or vice versa. Like, we need clean air, we need lots of air. And so diaphragmatic breathing is really helpful for anybody who has kind of developed maybe tightness in their chest from posture, sitting position over an extended period of time, or an old injury, or maybe an old pneumonia, that you just kind of still haven't been able to get the deepest breath, and you fall into that pattern of incomplete, insufficient, full breath taking. And diaphragmatic breathing can help restore some of that. So it's a great thing to learn as you're trying to move your body more, breathing more, expanding that chest cavity, getting the air to the ends of your fingertips, the ends of your toes, up into your brain cells, really, really capitalizing on that. And then also this Cranio-Sacral Release. We're getting at some of the basic small units of our body that need to move to fuel us to instill the most healthy system that we can. And so I hope you enjoyed this information, and please subscribe and continue to follow me as we work through this year and have the opportunity to gain tools to increase our health and vibrance. Thanks, and have a great day. Bye.
And now you're going to take your hands and place them down around your pelvic bone. Your pinky finger should lay on your pelvic bone, your pubic bone, and your hand should fall into the soft part of your abdomen, at the lowest part of the abdomen. Allow your hand to rest softly in that space, and as the tissues allow, you may sink in, but you're never pressing in. The amount of pressure should be like the weight exerted by a nickel on your skin. Very, very soft, very, very light, and it's just sinking in. You may feel a opening or a softening, and that would be signs of a release happening. You may find yourself with a yawn or a deep inhalation, and that would also be a sign of a softening. And once the release is completed, you may move to the next spot. And now you're going to find the breathing diaphragm, find the lowest rib, and place the lower thumb on the lowest rib, and the upper part of your thumb will kind of point up towards your sternum. The majority of your hand will fall into the uppermost portion of your abdomen and rest there softly as I described before. as you're doing this exercise and your hands are resting softly, you may be wondering if you're doing anything or how you might feel it. And so with practice, it will come. But initially, the things that I mentioned with the breath and yawning, taking a deep breath, those are some signs. It's basically just a softening feel, and if you think you feel it, you probably do. So try to move out of that skeptical questioning phase of yourself and trust that your hands and your body will respond and speak to you, and that what you feel really is present. As we move to the next diaphragm, you're going to take a widespread thumb and index finger of just your one hand and find your collarbones. The tip of the index finger with a widespread hand to the tip of the thumb are going to lay across both collarbones. And actually move it up a little bit so that those two fingers fall into the soft spot above the bone. But those fingers will still be touching the bone, but they'll be laying on the soft spot above them. And this is your upper lung point as well. The tip of your lungs comes up to just under the collarbone, so your lungs come up that high. And so the rest of the hand is going to fall and lay gently on the prominence of the collarbone and the top of the sternum and the top of the rib cage. Resting softly as I described before, and allowing that area to soften and open. You may again notice a deep breath that's needed, or even a yawn. And so just continue on there, on that space, resting in that until you feel a release, or until you think you feel a release. You may also support your upper arm and elbow if that helps you to relax, but it's not necessary. And for the last diaphragm, you're going to take your thumb and index finger and go up into the neck. If you're a man, you're going to find your Adam's apple. And for a woman, even though it's not as distinct, find that area of the trachea. Come a little bit to the lower aspect and feel where there's a little indentation in the side, and that is the junction of where the hyoid bone begins. And so you're going to gently place the thumb and the index finger on either side of that and just rest there softly. Your body will demand you to rest there softly because it is a sensitive area to begin with. And if you need to cough, just do that and come back and try again. If you're really not able to tolerate touching that area, then just try to be nearby or more softly on the space until your tolerance improves. Enjoy releasing these diaphragms. Take your time and give yourself some patience and credit. And if you experience any feelings of rush or heaviness in the head, please let me know by leaving a comment or a question or a message in either the YouTube channel or my Facebook page, and I will give you some tips to manage the increased flow of craniosacral fluid to the brain. Thanks for joining me today. Best wishes as you try this new exercise, and please follow me on Facebook at Lori Herring PT, and subscribe to me here on this YouTube channel, Finding 50 Fit. Thanks so much and have a great week. Bye-bye.